this video, we'll be seeing about the parotid gland. The parotid gland is the largest salivary gland. It weighs about 25 grams. It is situated below the external acoustic meatus, and it extends anteriorly from the angle of the mandible and posteriorly till the mastoid process. Anteriorly, it overlaps the masseter muscle, and posteriorly, it overlaps the sternocleidomastoid muscle. Its external features: the gland resembles a pyramidal, it is a three-sided pyramid. The apex of the pyramid lies in the carotid triangle. It has four surfaces: the superficial surface, superior surface. The medial surface has two, anteromedial surface and the posteromedial surface, and it has three borders: anterior border, posterior border, and the medial border. Its four surfaces: the superficial surface, superior surface, the anteromedial surface, and the posteromedial surface. Then it has three borders: anterior border, posterior border, and the medial border. The apex of the parotid gland covers the posterior belly of the digastric muscle. It lies in the carotid triangle. Its superior surface is related to the superficial temporal vessels and the auriculotemporal nerve. Superficial fascia also has the skin. The superficial surface is covered by the skin, superficial fascia, the parotid fascia, and the few deep parotid lymph nodes. Anteromedial surface is grooved by the posterior border of the angle of mandible. It is related to the masseter, the lateral surface of temporomandibular joint. The posteromedial surface is related to the mastoid process, the styloid process, the external carotid artery, and the facial nerve. The anterior border is related to the parotid duct, the transverse facial vessels, and the accessory parotid gland. The posterior border separates the superficial surface from the posteromedial surface. It overlaps the sternocleidomastoid muscle. The apex is related to the anterior and posterior divisions of the retromandibular vein.
Here you can see it clearly.
Its posterior relations are the posterior auricular nerve and vessels. The superficial relations are the auriculotemporal nerve and the superficial temporal vessels. Now, talking about the nerve supply of the parotid gland, its sensory nerve supply is by the auriculotemporal nerve, parasympathetic is by the otic ganglion, and sympathetic is by the plexus near the external carotid artery. The skin over the parotid gland is supplied by the great auricular nerve. Its arterial supply is by the external carotid artery and its branches, and its venous supply is by the retromandibular vein.